But, so now I've got to do, I'm still in the room, right? Verify my patient. It turns out I need to draw a CBC and a CMP. So what color tubes do I need for bonus points? Lavender, green or gold for the CMP, right? Green or gold, and a lavender. So it's important to know your lab tube. I'm gonna throw something on the PowerPoint that's like order a draw. 'Cause I don't think we have anything in there that
That would
says.
be good.
I think it should. I think you got it in. Do you have it in the ID
No,
cert
lavender's
lab?
last.
I
Is
can't
it?
remember.
Because that has
Yeah.
EDTA in it.
Because it has a
Lavender last.
Yeah. So what I want you guys to remember is that in each tube, most tubes have an agent in them, right? So if you look at the tube itself, it'll say on here, right? It'll say vacuum container, the EDTA, right? It'll tell you the stuff that's in here. And if you look, there's the powdery stuff in here, right? So just be cognizant these different tubes, they're for different labs, different purposes. So as a nurse, it's good to know what these are because you don't want to waste your time and have to redraw after you've just accessed this and this whole thing, right? Because you want to just be drawing blood and be done, right? The other important thing to know about drawing labs is we need a date and initial, right? Oftentimes, where I work, we scan the patient and then scan the labs in, which is nice, and I don't have to initial or date. But for you guys, I just want you to be ingrained in your head. Typically, the default is initial, date, and time when you collect the labs. Because lab will call you and say, hey, you didn't initial these, and we're going to reject them, right? So just be cognizant what your policy is, right? Okay, so I'm actually going to be drawing. Lab came up and drew a CBC or a CMP earlier. So what is this tube for? Yeah, INR. This is a coagulopathy tube. So anything coags is in here, right? PT, PTT, INR, D-dimer, right? All in here.
Indicated by the blue.
Indicated by the blue. And if you guys know your labs, I'm gonna try these small. If you guys know your labs, like the different tubes, it's actually helpful because then you can figure out what you need ahead of time. Okay, so walk into the room, I'm still in the room, perform my hand hygiene. One of the things we didn't do, right? Can somebody think that, so we changed our dressing, what do we not do?
Change the cap.
Change the caps, because we're drawing blood, right? So this would be a good opportunity if we needed to change those caps. Also, oftentimes, when I say just the cap too, it's often change the hubs, right? So, you get your hub out, and then you'll purge air out of it, and that's how you change, right? So these are clean, so I can do that, and then I want to check, make sure patent, right? That's patent, so at this point in time, I grabbed a new one. This isn't the old one that I had. So I'm going to flush it, I'm going to lock it, put my cap on, and I'm going to do the same, right? And when I draw the blood, I'll just draw the blood and then I'll change it. Okay, so these. All right. So something's infusing, right? I got to stop it, right? So I stop it. I wait for 2 minutes. I've got to cap the IV line too. So you'll see these, just the inverse of essentially like the tip of a flush, but long and skinny, and it screws onto the end of the IV set, right? So it keeps it clean. I got my tubes. Got my flush. I've got my order. All right, I'm getting the air out. So this is locked. So I'm going to flush. And then I want to check blood return. I don't know if this will actually work.
It's locked.
I know, I'm not trying to push on it yet, but no, this will just make a big mess.
Yeah, you should be doing your blood draws from the port cap here.
Yeah, just on your chest or chest, some of them are set up, yeah, for the port, some are set for here, so just be cognizant which one you're pushing the blood or the fluid through, because they're not all set up. So we'll just
Move over
change.
to the port, yeah.
So this should be clamped, right? See where it says clamp here? This actually should be here. There's a reason for it, so it doesn't break down that lumen. So if it didn't have a cap on it, just scrub the hub, 30 seconds, wait. Unclamp. Make sure you're not making a big mess and nothing's clamped in the back. So how many mils?
10.
10 to 20.
I think it's 10 on our sheet, right? Some places are 20, 210 cc syringes. And then, so I've flushed it, guys, and I wanna make sure there's blood return, right? So I'm checking the patency of it. So, do this. Okay. If I waited by 2 minutes, I got blood return. I can then, there's two different ways to do this. I can get a 10 cc syringe, right? Clamp it, unclamp, and then I can pull 10 cc's from it if I wanted to do that. Or I can connect the vacutainer. Oh, vacutainer's here. There's different types, right? So just make sure you grab the right type that corresponds with the lure lock that you're using, right? So this is the type that I want.
It's the same one you use for IV, right?
Yes. Yeah, because this will be on the hub, will be the same on the end, yeah. So, got it clamped still, so I can take my tubes. Typically with a coag, you waste blood before you just draw straight to a blue tube. The reason is a blue tube needs to be filled all the way to here. If you don't waste a little bit, it doesn't get filled all the way and they'll reject it. Just a little pro tip. So in this case,
I'm sorry, say that again?
so with the blues, they
Yeah.
don't often fill all the way up, so you use a waste tube before you draw. This is, let's say this is a red with nothing in it, so you're just gonna draw. So it fills, there's a vacuum in here. So this is our waste tube. And this doesn't have enough vacuum in it, remember I said? Okay, so now you can close it, there are your labs. If you look on these tubes, it'll say the mils on the side, this is 2.7, on a blue tube it has a line. I have not met that line, so this is not a good sample.
So what does that mean?
That means you just draw with a syringe because you don't have enough vacuum in there, or get a new syringe, it might have lost its vacuum. So if it gets old, it may lose a vacuum. Sometimes people take the tops off and fill it and boom, you just lost your vacuum, right? So just be cognizant that there's different levels of fill here for these. So I got this,
For your skills demonstration, don't worry about
yeah,
it.
Okay.
Most of the tubes are not gonna have any vacuum in them.
so,
We'll just say it's full.
Yeah.
and this one fills, right? Ish. Okay, so I've got my lab tubes here. I've locked this. I got my flush. Not touching the tips, right, with anything. So unclamp. Flush. Careful when you flush this much, because it might be overfilled. And so if you feel like resistance, just be cognizant of that. So verbalize 10 mils, right? Okay. So it's flushed. I grab a new cap. Put the cap back on here. These can go in biohazard, right? We don't really want to get in the habit of putting these in sharps. This can go in the garbage. Where does this go?
in the sharps,
Why?
because that's a needle.
Yeah, and this, if you put your finger in here, there's a needle right there, right? So some people forget about that. So yeah, definitely sharps. So now we've got our tubes, right? So we need to
Label.
Initial and
patient labels, date and time, right? Then we get our bio bag. The biohazard bag, we seal it. And then we would document, we clean the dressing, right? Or we did the sterile dressing change. We replaced the caps, right? Drew the blood and sent it. And then asked if the patient needs anything, right? For oftentimes for these guys, like I said, it's positionable, right? So in the real world, you might have them have to move their arm or manipulate their body a little bit because you're not, when you try to draw from it, it won't draw. And you're like, damn it, what the heck? Well, sometimes it's just up against something. And so when they move, it'll open it up and be like, oh, okay, perfect. So with that being said, you want to put the patient back into a position of comfort. You want to adjust the bed, right? You want to make sure that the bed is locked, the patient has the call light, see if the patient needs anything before you leave, get all your documentation done. You take your dirty things, all right, here's our lab stuff. And then hand hygiene. You're done. Questions?